Welcome to Connect. I'm Sio Hernandez, and on today's program, we talk about emergency preparedness and what you can do to protect yourself, your family, and your pets from the unexpected. In our first story, we talk with Troy Peterson of the Marin County Emergency Medical Services.
You're on the MarinGChannel. I'm Jerry Kay. With me is Troy Peterson, and you are with something, the letters are EMS. What does that mean, and what's your job?
Yes, Emergency Medical Services Agency. I'm an EMS specialist here with the County EMS Agency. The EMS Agency coordinates all the emergency medical services response here in the county.
All medical emergency responses. How broad? What does that really mean?
When someone calls 911 when they have a medical emergency, such as shortness of breath or having chest pain, that they know that the dispatchers that first of all, that they're there to answer the phone, and that they're trained and know how to do their job and do it well and be able to dispatch the help that they need. Then the help that arrives, the first responders, the fire department, EMTs, or paramedics get there in a timely manner. When the paramedics get there, they have protocols that help them be able to treat the patient and then transport the patient to a hospital, making sure that all these components work well together so that the people know that when they call 911 for an ambulance, that all the services are there for them. Best thing to do, of course, is be prepared for any emergency. And we really like to see people be prepared to be on their own, for example, after an earthquake for at least 3 days. That means having a kit with food and water being at least a minimum of 1 gallon per person per day, and having the other things that you would need if you were on your own, maybe, for example, camping. What do you need? You need something to sleep in, you need spare clothes, food, remember the can opener, and if you wear eyeglasses, you want to make sure you have spare eyeglasses, medicines, those kinds of things. Also remember any special needs that any of the elderly or children may have, as well as any pets. You always want to remember to take care of them. So having a kit's really important. You want to have a kit at home, maybe a smaller kit in your car, even a kit at your desk where you work. It's always good to be prepared. If you are stuck for a few hours somewhere, particularly with that kid in the back seat, you can go into your disaster kit, pull out the water, the snack food, and hopefully you have a toy or something in there if you don't have one with you that you can pull out and use as well. Part of being prepared also, besides just having the supplies, is having a plan. This plan would be, first of all, having someone out of state so you can have an out-of-state contact in case there is a disaster. You'd be able to contact that person and leave messages so that you'd be able to communicate with your household or family, and everyone would know you're okay or what's going on. Also, making sure that everyone in your family is aware of those numbers, they carry the number. And a plan could be starting as simple as how to get out of your house in the event of a fire and where to meet. From there all the way up to having all the supplies. And finally, of course, it's really good to be informed. Find out what kind of threats there are in your neighborhood, whether it's flood from a local creek, a hillside that might have a mudslide. And of course, we all know that the earthquake is a big threat, so preparing for the earthquake will prepare you for all these other things. We always recommend people take CPR and first aid classes. That's always great information to have, just in day-to-day stuff, and even if it's not a big disaster, but those minor emergencies that occur. So having CPR and first aid knowledge is very important, and people can get that information from our website at MarinEMS.org, and then we have a list of where people can take CPR and first aid classes.
Thanks, Troy, for being part of this edition of Connect. Next, we talk with Brian Waterbury from a vital resource here in Marin, the Marin Medical Reserve Corps.
The Marin Medical Reserve Corps is actually a nationwide program that is housed in the Surgeon General's office. The concept is to tap into local resources, your local community resources in a time of public health need or a disaster. Everybody knows that the day-to-day operations of the medical systems in the local communities are probably at peak at any time during the day. So anything that impacts on that will have a tendency to degrade the delivery system. Right after 9/11, and then reinforced by the hurricanes that followed, the federal government came to the realization we can't be there all the time. Local government doesn't have enough resources to impact a large disaster. The state government can't respond fast enough. So why don't we look in the local communities and see who lives in the local communities, what kind of skills they have, Can we get them to volunteer? Can we get them some training? Can we get them organized so they can augment existing medical systems? And so that's what we're doing here in Marin. I think the power of a disaster response lies in our neighbors and ourselves. It's a very powerful thing to be able to pull together, be trained, use our skills to help each other. The Medical Reserve Corps is really open to anybody that wants to get involved. We do have doctors, physicians, nurses, paramedics, EMTs. We have a large mental health contingent. Currently today we have about 310 Medical Reserve Corps members throughout Marin County. We don't have medical emergencies or public health emergencies every day, although we are currently involved in this H1N1 novel flu event. So we are constantly doing training, we're constantly doing exercises, we're working with the hospitals. We've even worked with surrounding counties and helped them with their flu clinics. Keeping the volunteers engaged, getting them that training, getting them that practice really pays off, and it's paid off really well, especially here in Marin, with this H1N1 flu clinics, which, by the way, 50% of the staff at these H1N1 flu clinics that are currently going on are Medical Reserve Corps volunteers. So the more people that we can get trained, the better off we're going to be in a disaster. This is a national recognition from the Surgeon General's office. Currently there is over 800 Medical Reserve Corps units throughout the United States and close to 800,000 volunteers. This award we got for 2009 for the work that we've done in the community. We are considered at the national and the state level a best practice Medical Reserve Corps. And this is the 2009 Resiliency Award from the Surgeon General's office, basically saying that we're the best Medical Reserve Corps in the nation.
Thanks, Brian, and congratulations on the Resiliency Award you and the Marin Medical Reserve Corps received. I've seen you in action. You deserve it. Next up, Carrie Harrington of the Marin Humane Society talks with us about keeping our other loved ones, our pets, safe in an emergency.
Hi, I'm Carrie Harrington. I'm the Communications Manager at the Marin Humane Society, which is a 102-year-old progressive animal shelter in Marin County, and we are also responsible for the county's animal services through a contract with the County of Marin. We offer a host of programs and services, including adoptions, education, behavior and training classes for people's pets, and then also programs to assist low-income seniors and disadvantaged people with pets throughout the County of Marin. For a number of years, we've been working with the county, the Office of Emergency Services, and other agencies to prepare for a disaster. We are here as a resource to help people with their pets if they need to evacuate and don't have an option to bring their pets with them. We will take in stray animals. We will board animals while people are figuring out what they need to do during a disaster. The Marin Humane Society is here as a resource in times of disaster, but at the same time, you never know what position we'll be in a disaster. Will this building hold up? Will the roads be passable? So we want people to also have an alternative plan. When pet guardians ask us what they can do in times of a disaster, what's the most important thing, it's to be prepared. The Marin Humane Society's website is a wonderful resource for pet disaster planning. You can visit us at marinhumanesociety.org. We have an entire section devoted to pet disaster planning. We include items that you want to include in your pet disaster kit, a pet first aid kit, photos of your animal in case your animal becomes lost, medications for your pet, pet food, water bowls, just really the basics in case you don't have access to the basic necessities over the coming days or weeks after a disaster. We also have items like links to lost and found flyers that you might need in the event of a disaster. We also have links to other agencies we work with throughout the county, such as the Office of Emergency Services, so you can learn how to incorporate pets in your disaster plan.
Here are a few more resources to learn how you can prepare for an emergency. Thanks for watching Connect. Remember to listen with all your senses, know your communities, and connect. I'm Sio Hernandez.